Welcome to the COVID-19 Task Force Daily Update. Well, we have two guests joining us today. Then Lloyd Phillips, the Commissioner of Public Safety, will be joining us. So let's start off with a topic that we haven't talked about very often: shopping. Well, to talk about it and bring us some details and why you should be listening to this, Leslie Walker-Rice from the Kahnawake Memorial Hospital Center. She's the Infection and Prevention Control Nurse, so let's welcome her along. And this should be a little bit interesting. Leslie?
Hi, good afternoon. It's a beautiful day in the neighborhood. And I want to thank everybody who came out yesterday, which was a very touching moment for all the employees of Kahnawake Hospital. The parade was fantastic. And it really made a huge impact on the workers in the hospital. So I want to thank you all. So I want to talk about my favorite topic, shopping. And we all have been denied shopping the way we'd like to for quite a while now, actually 2 months. But there's some things to consider before you go out for a shopping trip, because things still aren't back to normal and you still need to protect yourself when you go out shopping. So there's some things that you should be looking out for and some things to prepare. And one, really reducing your exposure to potential virus sources. And they can be multiple. It can be people you come casually in contact with in the parking lot. It could be at the door. It could be interactions in the aisle of places. So there's some things to look for. So what you want to make sure is when you're going to a place that there's some organization or structure as to admitting people. There shouldn't be just crowds milling about outside. There really should be some kind of organization maintaining social distancing. Everybody's going to be excited. Everybody wants to go in and get the latest whatever, or even food. But you need to be mindful of maintaining social distance. Another thing, if it's dirty outside, if there's gloves, if there's masks, if there's a lot of debris around, if they're not looking outside, what is it going to look like inside? So really being attentive to your environment. When you go in, do they have hand sanitizer? Is there somehow a way for you to protect yourself when you go in? A means to wash your hands? Certainly, do they provide you with little disinfecting wipes to wipe off the carts and so forth? If not, bring your own. Bring a little plastic baggie with your own. Bring some hand sanitizer. Look, see if there's directional routes through the store. We have some excellent examples in the community, in the stores, where they've actually, you know, there's little signs and they tell you how to go. One way, no way, and you want to make sure you always go the right way down the aisle. You want not to linger. Okay, when you start lingering, people they want to chat and they'll conglomerate. Certainly, if you go to a grocery store and they have one of those self-serve, take the olives out, take the pickles out, leave. Okay, they're really not recommended right now. Don't hang around. If they have one of those, they're not paying particular attention to the health of anyone. So saying that, if they're not paying particular attention to their employees, if their employees are not provided with means to protect themselves against the general public, if they're not being considerate of their employees, maybe they're not being considerate of you as well. So be involved in your shopping experience. Wear a mask if you want, but wear it properly. Wear it over your face. Don't touch your face. Don't wear gloves. You don't need gloves. You just need to wash your hands at every opportunity. Don't fondle the produce, okay? And if there's a monitor for the produce, bonus. If there's no, you know, if you see someone and they're going around and they're touching all the produce and they're fondling the tomatoes and they're, you know, checking everything out, it really go shop somewhere else. So being mindful of practices. How do you pay? You know, are they still using cash? A lot of people don't want to use cash. Touch is better. That sort of thing. Salad bars, crowds not regulated, facial protection, just going through my list. There's another thing I want to talk about. There are opportunities where we might experience, not necessarily shopping, but it is business practice, where we need to have tradespeople come into our house. We might need an electrician, we might need a plumber, you might need a service repairman. You have the right to ask them if they are sick or not. You have the right to ask them to wash their hands and to wear a mask before they come into their house. And you also have the right to request a different kind of payment where you don't have to sign forms, where they can send you an e-billing system. So saying that, we'll be able to shop more, but I'd like to encourage you to stay closer to home, because it's still a big bad world out there, and there's a lot of virus out there that we really don't need to be in contact with. So if you can shop local, do so. If you can order out and have it delivered in, do so. If you can order and go pick it up, do so. But always be mindful of safe hygiene practices to protect you and the people around you. On a final note, I again want to thank the community for the fabulous parade. It really brightened our day.
Thank you, Leslie, and some really good information there, especially with the inevitable opening of stores in the region. Also, just a good idea, even locally, shopping, to keep doing all of those good things. Coming up next is Dawn Montour-Lazare. She's the manager of outpatient care at the Kahnawake Memorial Hospital Center. And another topic that has come up over the last couple of months has been self-isolation, but we haven't talked about it in depth and with some explanation and probably some helpful information for you. We'd like to welcome Dawn.
Nyawo Sego. I'd like to give a big nyawo to the community for the beautiful parade. For most of us at the hospital, we became quite emotional watching everybody pass by. To see 118 cars, as one person counted out, was overwhelming, and I want to thank you for that. So I'd like to talk about prepping for self-isolation. So it's not just about when it actually happens, but we got to start thinking about it like right now. You don't want to wait till the last minute to do that preparation, because it's very difficult to do, and I can talk from personal experience because it happened to me. So what I'd like you to do is just start thinking about where you can sit yourself for 14 days. So if you're exposed to someone who is COVID positive, or if you start showing symptoms and you go get tested, you will have to self-isolate for at least 14 days. So you want to find yourself a room that you can go into, and knowing that you want to use that space, it would be a good idea to declutter the space right now so that there's less things for you to decontaminate at the end. Ideally, it'd be best if you could have a bathroom to yourself, preferably attached to the room. But if you don't have one, at least if you have a bathroom that's dedicated to you, that makes a big difference. I realize that some homes only have one bathroom as well too. So the other thing you need to do in that case would be to make sure you have cleaning supplies in your bathroom. Because every time you go into the bathroom, you'll have to clean everything down, clean the sink, clean the toilet, everything, so that nobody else gets in contact with any of the virus while you're in there. You also want to make sure that the room has a source of fresh air. So you want to have someplace that can get a window, because it's going to be very important. Let's say if you start getting sick, to get some fresh air for your lungs. Also, if you're planning on working from home during that time, it might be a good idea to check to see your Wi-Fi accessibility from the room that you're going to be using, because it becomes problematic, and not everybody has good internet access in their home, or you have a dead space in your room. You want to make sure that you're okay. The other thing you want to do for preparation is to get some basic supplies that you would need. Cleaning products are a good one. We don't have, everybody's using a lot of Lysol wipes, and I see people making comments about not having enough Lysol wipes. But remember, we can go back to the basics and use, you can use bleach and water. You can use Lysol all-purpose cleaner with a rag. You can get back to basics. Soap and water works really great. Hobby supplies, or anything you want to do to keep yourself occupied during those 14 days. So it's reading materials, beading materials, yarn, wool, your sewing machine, the material, whatever you want to do, put in your room. Snacks are a good thing to have, preferably things that don't need to be in the refrigerator. My suggestion is granola bars, fruit cups, things like that. Kleenex is very important as well too, because you want to pass anything over as much as possible during that time. garbage bags. So when it comes garbage day, you can close the bag and the garbage can be thrown out with everybody else's garbage, as long as the bag is closed. One of the suggestions as well too is you could use the garbage bag as well to put your laundry in it as well too, so that when it's time to wash the laundry, the person who's in your house can take the bag and deposit it directly into the washing machine and dispose of the bag. Tylenol and basic things to take care of yourself. Tylenol, Advil, anything that will lower your temperature, and a thermometer. Because once you're in self-isolation, the public health will be calling you on a regular basis to see how you're doing, and one of the things they ask for is your temperature. As Leslie was talking about deliveries, one of the things that's going to be hard while you're in self-isolation is about making sure you can eat, and you want to eat healthily. So, either if you're getting deliveries from restaurants, you have to think about how you're going to pay for these things. So preferably it'd be better if you're paying by e-transfer or tap or something like that. And some places I know in town are still only using cash. One of the suggestions I make is put the cash in a Ziploc bag and have somebody wipe down the bag, and you can give it to the person, and at the other end they can clean the money if they want to at the other end, or they should clean the money at the other end. So that's the things that you have to worry about when you're thinking about planning. But the other thing is isolation. So what's the key concepts of self-isolation? You want to make sure that it's you. If it's just you that's sick, then you need to be the one that's in the room. If everybody else is starting to get sick, it's still better if people are in their own rooms. So because even though you think you might be sick, until we get positive or negative results, you might be still infecting somebody that may be positive at that time. So it's better if you all isolate in your own rooms. And once you're having symptoms, once you've been exposed to someone, once you've been tested, you have to self-isolate for 14 days. That reason for that, well, if you have COVID, 14 days is typically about the amount of time it takes for the worst of the illness to go away. But that being said, you should at least have not had fever in the last 48 hours before you leave your isolation, and at least 24 hours without any acute symptoms, which would be like like the fever especially, and some of the GI symptoms like diarrhea. But some of the things that may last even after the 14 days are cough. You will have a residual cough for a while, and the loss of smell and taste can last for quite a few weeks afterwards. And self-isolation also means you're not going out of your house. So this is why I'm suggesting you prepare ahead of time, because you don't want to not feel well, go to the testing center, and then they're telling you, well, you need to self-isolate, you can't go out after this. Well, I just need to go to the bank. Oh, well, I just need to go to the store. It's not the time to do that. You need to do that ahead of time. And with banking, as much as possible, it'd be better if you were doing it electronically if you can. And if you don't have that capability yet, it's a good time to contact your bank and make sure you can make those arrangements now. So the only place, like let's say if you're going to go out someplace, would be in your yard, because it's an extension of your house. But if you have other people in your house, you have to make sure you're not crossing their paths when you're going to go outside. So if people, I know there's going to be people that are going to be, people are really watching each other and making sure that they're following the rules. Just be mindful that if they're not leaving their yard, they're not breaking any rules. We need people to go outside and get some fresh air and to change their mind. It's stressful enough being in isolation for 14 days, so we need to be kind to each other. We need to be helpful for each other, and we need to look out for each other. So if you know someone is in self-isolation, offer to help them, offer to go for their shopping, go get their food, prepare meals, drop it off at the door, clean it off, drop it off at the door, and let them come out to get it. We need to look out for each other, and Kahnawake is really good for that, as we saw yesterday. So just stay safe and stay healthy. Go.
Right, now, Don. And, if you are in self-isolation and you are going to go into your yard and you're keeping everything disinfected, remember, these little guys are pretty good too, so bring it with you so you can make sure you at least clean the doorknobs too, because those tend to get forgotten sometimes. Also, just a note before we carry on, Leslie was mentioning deliveries that come from out of town. At this point, the only deliveries that are from restaurants, just to be clear on that. All right, joining us now is the Commissioner of Public Safety. After a long day of meetings, he joins us on our COVID-19 Task Force update. Lloyd?
Thank you, Leslie and Don and Joe. Good afternoon, everybody. I'll be brief this afternoon. I just got a couple of points to raise with you. We did not have a task force meeting today. We decided to postpone it until Friday to give the day-to-day operations time to do a little more strategic planning and work on some timelines and some steps that we could present to the task force in entirety, as well as obviously then eventually to the community on what does the progression of the pandemic, what's the progression of business opening, what's the progression of measures on the community, and when could we look at modifications to those things. Obviously we put a lot of information out already and more information coming about regarding businesses, but also we want to look at what does it mean to you as a community member who is not involved in business. And so we're trying to put something together to have a visual for the community. But one thing we was clear after our discussion this afternoon that it's very, very difficult. There's so many factors that decide when various measures can be released, because there's a lot of factors that are beyond our control. Obviously, Kahnawake, we have certain restrictions in place, certain measures in place to protect Kahnawake. But if things around Kahnawake start opening up and start changing, obviously that will have impact on our community. If people leave Kahnawake and go into the city or go into Chateauguay and other places, once businesses really start to open up, obviously that will have impact on our community. As well as we always say over and over that our community has much more vulnerabilities than other communities. So we want to make sure that what we're doing in between each step as required, we're going to be doing health checks to much like the one that's currently on its way, to make sure that before we continue evolving and opening up more businesses and releasing some measures, that we have to have strong health indicators that allow us to feel comfortable moving forward in that section. So there's no concrete plan in place yet, but I just wanted to let the community know that, because this things are not stagnant by no means. There's a lot of work and a lot of information happening and being gathered and that way so we could present to the community. So I just wanted to relay that to you. Because, matter of fact, just today in the National Assembly of Quebec, the Premier was criticized by the opposition, and one quote that was said is, he's driving a boat with no rudder, and he has no plan to navigate the waters he's in. He's being hit hard by the political opposition, and that's the situation that everybody is in, to a large extent, but it seems lately, Quebec has been really not clear and not very decisive on where they're going. And that's one thing, as a task force, we want to be as clear and concise as we possibly can, knowing that there's all these gray parameters out there, there's some unknowns, but to navigate as best as we possibly can and have a plan to move forward, something that is structured in a way that people could easily understand the steps that's required to get us to that sense of normalcy again. It's still going to be a road. It's still going to be a significant amount of time, but we want to lay something out that you'll be able to take a look at and at least have some indication where things are going. Because it's been 2 months. We've been in this pandemic, and I know things are getting hard on everybody. But with Leslie speaking here and talking about shopping and taking some precautions and knowing what to look for, and Don talking about self-isolation and the repeated messages we talk about social distancing and hand washing and not touching your face and things of that nature are still extremely important to know, because that's gonna be the new normal for a long time, and to know what self-isolation is, even though you may have heard it many times, it's good to repeat it, because as things start opening up around us and as businesses start to open and various measures change and people travel outside the territory more, The important thing is still to have testing available, which you have in the community. We also have to be able to have contact tracing to find out where that person has been, and also have that person isolated as quickly as possible. So knowing that you have the information on what self-isolation means, again, it's very useful, for you to have that. So there's a lot of things that the task force, we have taken measures, we put things in place, we took a lot of responsibility on behalf of the community, but over time, that responsibility, is going to be resting, with the community as a whole, to take care of ourselves. And looking after the collective is going to be our collective responsibility. I mean, it is now, and everybody's taking it seriously, but as things evolve, that more and more responsibility will be on community members, on businesses, on organizations to move us forward to the next steps. I just want to raise two final points, and I don't talk about numbers very often, but certainly if you take a look at the recent numbers in terms of number of deaths in the province of Quebec, today the number was released, it's 3,220 deaths as of today, increase of 89 since yesterday, and I think the day before that was 140 or thereabouts. So if you do the averaging, they're still averaging about 100 people per day dying in the province of Quebec, which is still, a very high number of people who are dying. And the numbers are not really under control in the greater Montreal area. So we got to keep a very, very close eye on what's happening out there. Because if you look at some of the other projections that were made, when measures are released, businesses are opening in the greater Montreal area, more contact happening, with individuals, that contact goes up by 20–30% more contact than you're having now. The spread of the virus accelerates rapidly. And one of the scary numbers that they did predict is if that trajectory stays on that path, we could see as many as 150 people per day dying of COVID-19, and that's not including people in the seniors' residences, which right now the bulk of the deaths have been in the senior residents. That's not including that. So if you add those 100 a day or so that have been dying in those residences, we're looking at a very large number. So we can't ignore those numbers because in our planning moving forward, I put that back out there again for people to ponder that, because as much as we talk about looking forward, we have to remember that we're still currently in a pandemic, and we have to keep that in mind, and we always got to keep that in the front of our minds as we're planning to move forward. And we'll look forward to presenting that stepped plan and some of the tools that we need to assess to the community as soon as possible. So I want to relay that information to you, so there's still a lot of work happening behind the scenes. Kahnawake.
All right, thank you very much, Lloyd. And Lloyd mentioning the greater Montreal area, and I know some people aren't, there hasn't been a definition of that out there quite often enough, I think. And greater Montreal area is not just the island of Montreal. When they talk about the island of Montreal, that's different. Greater Montreal area is all the surrounding areas, and we're actually in that area, so that's why we have to be very cognizant of what goes on around us. We have been very fortunate so far. Before we leave, just a little note, the phone calls continue to come in as things change, for example, with the pools allowed to be opened, or people coming in to open up the pools. Other calls have been coming in for various types of repairs. So remember, the essential businesses that are allowed to be open right now, it all continues exactly as is, with that exception at this time. So just continue to carry on. Essential repairs are, if you have a hole in the roof, of course, you can get that taken care of. But you can always call 450-632-0635, and that is the Community Protection Unit, or actually Public Safety Division of the MCK now is what it's called. But that number again, 632-0635, and they will be able to help you out if you have any questions at all. So that'll wrap it up for us. We'd like to thank Leslie Walker-Rice and Don Montour-Lazare for joining us, and of course Lloyd Phillips, our Commissioner of public safety. We shall see you tomorrow on the COVID-19 Task Force Daily Update. On behalf of all of us here in Yauko, Adano, Onigiwahi.